My name is Ray Kim. I'm Chief of the Division of Gastroenterology and Hepatology. And I'm really pleased to kick this off a new series, as you see here, Eating Right, a series that we have developed to share our experience and expertise in dietary therapy and various GI disorders. So today's the first presentation. We have several others scheduled, and the subsequent ones will be announced towards the end of the presentation today. I just wanted to thank everyone for joining. And I think we have a Q&A prepared. So that will be the latter part of the presentation as well. So as you just heard from Shannon, we will have a brief introduction from the medical standpoint by Dr. Nielsen Fernandez-Becker. And the bulk of the presentation will be Ms. Neha Shah, who is our dear dietary specialist that helps with many GI disorders over the years. So without further ado, should we go on?
Sure. Well, welcome everyone, and thank you for the introduction, Ray. I'm delighted to kick off this Eating Right series, and today Neha and I are going to hopefully show you how to thrive well with a gluten-free diet. In the course of our webinar, we hope to answer the following questions. What is gluten? How does gluten cause disease? What are the basic epidemiology and treatment of gluten-associated disorders? What is the gluten-free diet? How do you implement the gluten-free diet? And how do you maintain the gluten-free diet? So I'll start from the very beginning. So what is gluten? So gluten is a storage protein that is found in wheat, barley, and rye. And these are very common grains that are used in baking. The chemical structure of gluten is such that it is resistant to digestion in the small intestine. And what happens is that parts of gluten protein remain intact and they're capable of activating an immune response, and that causes disease. So why would there be a medical reason to avoid gluten? This figure tells you about the so-called gluten-related disorders, and they fall into three broad categories. Celiac disease is an example of an autoimmune type, whereas wheat allergy is allergic, and non-celiac gluten sensitivity, which is less well understood, is neither autoimmune or allergic. Now, we know a lot more about celiac disease than the other disease entities. And the bulk of the talk of my part, will be discussing the pathophysiology of celiac disease and try to make a case for why you need to be on a gluten-free diet if you have this disease. But we'll also touch on the other disorders. So what do I mean by autoimmune? By autoimmune, we mean that the immune system is in a sense, attacking itself. So in order to understand that, I think it would be important for us to take a moment to understand what our immune system does. The immune system is comprised of many specialized cells that you see here, including lymphocytes, which include T cells. And basically, these immune cells, in a sense, patrol are surfaces where you may encounter infections. And the goal is to keep us healthy, to protect us. And the GI tract is actually our biggest immune organ. And whenever there's immune dysfunction, that results in disease. In celiac disease, the basic problem is that the body is recognizing gluten as a potential pathogen or invader. So what you really want is an immune system that can recognize what's bad for you and what poses a threat and protects you, but it shouldn't react to something that is an important nutrient or something important for your survival. And the basic problem with celiac disease is that that's what happens. Gluten, for whatever reason, is thought to be a potential problem by your immune system. And celiac disease is the only disease that we know of where it starts with a dietary protein and through a process that we'll talk about, results in autoimmunity. So we'll start, celiac disease occurs when someone who has a genetic predisposition eats gluten. And what happens there is that there's an inappropriate immune response. And what I mean by that is, like I just told you, that the body recognizes gluten as a potential pathogen or a foreign invader. So it activates these cells that are there to protect you are activated. And this is what we call inflammation. And here, after you've eaten some gluten, it's lining your small intestine. So these inflammatory cells actually go to the small intestine. And what happens next is that in a misguided way, in a misguided attempt to protect you, the immune cells attacked the small intestine. Here, they're represented by these archers that are taking aim at the small intestine. And this is a situation where I kind of call friendly fire, because the immune system is doing everything it can to protect you, but the consequence is that your own body is attacked. So to understand the consequences of this, it's important to understand some basic anatomy and physiology of the small intestine. In this cartoon, you see the human digestive system. So the small intestine is connected to is basically between the stomach and the colon. At the end of the day, the GI tract is one long tube. Starts with the esophagus, then the stomach, and then the small intestine. The small intestine is a vital organ, and it's very long. It's about 20 to 22 feet long. And it's a vital organ, meaning that it is incredibly important for your survival. And you could live with a stomach, you could live without a colon, but you cannot live without small intestine, because that is where nutrients are absorbed. And the small intestine, this cartoon illustrates what the small intestine is organized like. And it's in order to be able to absorb necessary nutrients, the lining is organized in such a way as to increase the surface area. Therefore, there's these finger-like projections that protrude into the lumen or the inside of the small intestine, which increase the surface area. This is what we call villi. And when you look at a magnified version of that, what you will see is that in the surface of the villi, you have these special cells that are called epithelial cells. And these cells are very similar to what you would find in your skin. In the core of the villi is where you would find the blood vessels, and this is where the immune cells are. And on this, in the bottom here, you'll see what it looks like under the microscope. And basically what you have is the epithelial cells are out in the surface, and right in the middle here is where you find all these little dots are the immune cells that make up the immune system. And the problem with celiac disease is that somehow gluten gets in there, and that's where all of the reaction starts. Okay, so this picture illustrates in a nutshell what the problem is or what the process is. Here we have ingestion of gluten, which is represented by donuts. You chew up the donuts, it releases the gluten, it gets down to the small intestine, and somehow, and that's where the immune cells come into contact with gluten. And what happens is that the healthy small intestine, which you see in this cartoon here, show these really nice, tall, slender villi, or these little finger-like projections, that over time, with repeated exposure to gluten, they get destroyed. And what you have is that the lining becomes very flat. And because the villi normally help you absorb things by increasing the surface area, this results in symptoms because you're no longer absorbing properly. So for those of you out there that are interested in the basic science background for this, this slide's for you. But basically, it's more a little bit more detail of what happens at the molecular level. And here is, so in this cartoon, these cells, these cuboidal cells in purple, basically illustrate those epithelial cells that I told you are lining the surface of the villi. And gluten here is represented by these little green rectangles. So what happens in celiac disease is that gluten somehow gets into the compartment where all the immune cells are. And there's an ubiquitous protein that's basically everywhere called tissue transglutaminase, which modifies gluten. And it is this modified form of gluten that then has a high affinity for the immune cells and is capable of activating the immune system. And two things happen. One is that cells are recruited that will then cause destruction of these epithelial cells, hence causing destruction of the villi. But the other thing that happens is that cells that make antibodies are activated. And as a result, we have antibodies against gluten and antibodies against tissue transglutaminase, that protein that I told you modifies gluten. Now, normally, when you have an infection, what the body does is that it makes antibodies to it. And and that happens because if you ever see that, or if you ever get exposed to that infectious agent again, then your body will be ready. And that's what we call immunity. In this case, the body tries, as part of the immune response, to make these antibodies, but the antibodies, as far as we know, do not contribute to the disease process, but they are markers for immunoreactivity to gluten. And it's one of the things that we look for when we're making the diagnosis. Now, it used to be thought that celiac disease is a rare disorder, but the reality is that it's pretty common and affects about 1% of the world population. And as you can see on this slide, it affects most of the world. So who gets celiac disease? Early on, I alluded to there being a genetic predisposition. Well, it turns out that 99% of patients with celiac disease, or over 99% actually, carry genes called HLA-DQ2 or HLA-DQ8. And these are found on certain immune cells. But when you look at the general population, only about 40% of individuals carry these genes. But of those, there's only a very small percentage, about 3 to 5% of individuals who go on to develop celiac disease. So the big burning outstanding question that still hasn't been answered is what makes these individuals that carry these genes all of a sudden develop celiac disease? And there's many theories that have been raised. And one of the one that has the most data behind it is the following. So the thinking is that in all individuals who carry these genes, that there's probably very low-grade reactions to gluten, but this is controlled and in a steady state. However, if there's tissue damage, or there's damage to the lining of the small intestine, which could happen with food poisoning, which could happen with infections, both viral or bacterial, then what could happen is that gives an opportunity for there to be an influx of gluten into that compartment where the immune cells are. And this then leads to a revved up reaction where that becomes a vicious cycle. And at this point, the only way that you could really deal with it is by taking gluten out. And this is what we try to accomplish with the gluten-free diet. So in terms of making the diagnosis, first there has to be a clinical suspicion. And the reason I'm putting this slide up here is to show you that even though many patients with celiac disease do have gastrointestinal symptoms, a significant percent do not. And some people are asymptomatic. Some people have other symptoms that have nothing, that are not gastrointestinal in nature. And it's important to recognize that. And in how do we make the diagnosis once we have that clinical suspicion? Well, like I mentioned before, part of the immune reaction to gluten is that some antibodies are made. These are antibodies to tissue transglutaminase, which is important in modifying gluten, and antibodies to gluten, which are called anti-gliadin antibodies. And we can detect these in the blood. These tests are very sensitive and specific, meaning that they're very good at picking up the disease. And when they're positive, they're generally, uh, they're truly positive and indicate that celiac disease is likely. But no diagnostic test is perfect. And we still rely, we confirm the diagnosis by doing an endoscopy. Now, when we do an endoscopy, after giving you some sedation, what we do is pass a flexible camera through the mouth into the esophagus, stomach, and into the small intestine. And we could directly visualize the lining of the small intestine. And in the upper panel, what you have is what we consider a normal small intestine. So the folds are very nice and delicate, and you could see the individual villi. So it has a velvet appearance to it, and it appears more like a lush carpet. And when you look at it under the microscope, each villus looks very nice, tall, and slender. But what happens with active celiac disease is that the villi are destroyed. So you see that the lining looks a lot smoother now. And there's also this fissuring or scalloping, which is areas that are lacking villi. And it also has this mosaic appearance, almost like a snakeskin appearance. And this under the microscope looks like this. As you can see, the villi are completely gone, and what you have is more inflammation left. So how about a wheat allergy? Is that the same as celiac disease? The answer to that question is that this is actually a different disease entity. And here, there are some immune cells involved, but they're different. Mast cells and cells called eosinophils tend to be the major players here. And this process is what we call IgE mediated. So these receptors recognize whatever protein you're allergic to. And once it sees that allergen, the cells are activated, and that causes release of many pro-inflammatory mediators, which does cause some GI symptoms like nausea and vomiting, abdominal cramps, and diarrhea. But it also comes with a lot of more systemic symptoms like hives, difficulty breathing, swelling of the mucous membranes, sneezing. And a typical example of a wheat allergy or of this type of allergy is what we would expect to somebody who has peanut allergies. Here, the process is not specific to the small intestine, and actually there is no damage to the lining of the small intestine. And the treatment with this would be to avoid wheat. Non-celiac gluten sensitivity, on the other hand, is a little bit more elusive, and we're still trying to grasp what causes it. But, and so far, there isn't really universally accepted definition, but basically, symptoms occur with the ingestion of gluten, and they go away on a gluten-free diet. The symptoms can be similar to celiac disease. The difference is that there usually is no damage to the lining of the small intestine. And there's many theories that have been discussed that may explain how wheat can cause symptoms. Some of it could be because of the carbohydrate component of wheat rather than proteins. Other possibilities is that there's other wheat proteins that can activate different arms of the immune response. And finally, gluten itself can activate different processes. The bottom line is like that we don't currently have a biomarker for this disease, and until we understand it better, it's hard to really say what the prevalence of this is. But definitely there are a subset of individuals who do not have celiac disease who clearly are sensitive to gluten. In those cases, the gluten-free diet could be very helpful. Now, the ultimate goal in celiac disease is to restore the health to the small intestine. In the left panels I showed you before is an example of a very severe enteropathy. And on the right side is an example of a very normal small intestine. The good news is that most of the time in celiac disease, the injury is reversible. And if we exclude gluten diligently with the gluten-free diet, then we could restore the lining to a healthful state. Now, this takes a long time, and studies have shown that it takes a median time of 3 years for the intestine to completely normalize. And while there is no standard guidelines as to when, if, and when we should repeat an endoscopy to show that the lining has healed, it is very common to repeat an endoscopy after 2 to 3 years of initiating the gluten-free diet, or earlier if there are symptoms involved. Now, I think I've made a case of why the gluten-free diet could be important to manage gastrointestinal disease. I'm going to pass on the baton to my colleague, Neha Shah, who will tell you the specifics of the gluten-free diet. But at this point, I'd be happy to entertain some questions. Are there any questions?
If anybody would like to ask a question, please utilize the Q&A portion underneath on the toolbar for Zoom.
Okay. Neha?
Yes.
Okay, go ahead.
Okay. As it was mentioned earlier, my name is Neha Shah, and I'm a registered dietitian, and I've been specializing in celiac disease and other GI and liver conditions for the past 15 years. It's an honor to be invited today to speak on the gluten-free diet, and I look forward to walking you through the gluten-free diet. So moving into the gluten-free diet. So in order to do the gluten-free diet successfully, there are 3 phases of the diet to master and follow. For some of you, it might be a refresher on some needed areas, and for others, it might be new info. Overall, you got this. Knowing all the ins and outs of the gluten-free diet can be overwhelming in the beginning, but with practice and the proper guidance, it's easier to follow. Learning the diet involves just really overall decoding the language related to gluten, knowing which foods have gluten, knowing the different terms that are used to describe gluten and what foods are gluten-free. Implementing the diet will involve developing skills in a wide variety of areas, say how to review food labels when doing gluten-free grocery shopping. Oh, certainly reducing any risk of accidental gluten coming into your foods in the kitchen that you may share with others. Or the other hand is, learning how to ask the right questions when you're doing gluten-free dining out. Lastly, to maintain the diet is really just knowing how to be consistent with this diet on a day-to-day basis. Is building habits over time, troubleshooting barriers as they come, and so that way you stay empowered, healthy, and well on the gluten-free diet. We are going to cover all 3 phases of the diet today, and we're also going to include some exercises so you can practice the gluten-free diet with us. So starting with learning the gluten-free diet, as discussed earlier, gluten is found in wheat, barley, malt, and rye. And any food that is made with any of these ingredients are completely removed from the diet. Examples could be wheat-based, gluten-based breads, wheat bread, rye bread, certainly any type of cereals or pastas. The diet will also remove other foods that may look gluten-free, but the gluten is used to flavor or thicken that food. So therefore that food is not gluten-free either, and it needs to be not eaten on the diet as well. Now, with that said, what does gluten-free mean? It was not formally defined before. The Food Allergen Labeling and Consumer Protection Act of 2004 requires all manufacturers to label foods if the foods contain any of the 8 major allergens. Wheat is actually considered to be a major allergen, so it will always be on the food packages. This act applies to FDA regulated packaged foods, but not all. Supplements such as fiber and vitamins, infant formula, and medical foods. However, the act does not require barley, rye, or malt to be disclosed. So therefore, as of 2013, the term gluten-free can be used on the food label if the gluten content is less than 20 parts per million. The use of this term is voluntary by the manufacturers. They do not have to write the word gluten-free on the package, but if they do, they must follow this definition set by the FDA. Now, with that said, although seeing the term gluten-free on the label makes it easier to identify that food for it to be gluten-free, it is still necessary to read for the terms for wheat, barley, and rye, as the act does not apply to all foods. To give some examples, the act does not apply to fruits and vegetables in its natural whole state, like a whole apple. It does not apply to other foods and beverages that are regulated by other organizations, such as meat, poultry, and eggs by the USDA, and certainly alcoholic beverages by the TTB, and any medication that are not considered to be supplements. So with that said, what are some of the terms for wheat, barley, and rye that we can highlight today? Like I mentioned earlier, it is really important to decode the language for gluten, and learning all these terms will help you understand if the food has gluten or not. I'm going to highlight a few examples. So bran, wheat bran has gluten. However, if the bran comes from a grain that is gluten-free, like rice bran, then it would be gluten-free. And certainly durum, einkorn, and farro are different types of wheat. And orzo is actually made from wheat, but it looks like rice. So it's important not to confuse the two. And then terms for barley, malt is made from sprouted barley. So this is malt extract, malt vinegar, malt syrup. Anything with malt, it comes from barley. And then brewer's yeast is a what we consider recovered byproduct of beer. So this is also from barley. So again, this is just a partial list, but knowing the terms for gluten can also help you identify whether the food is gluten-free or not. So with that said, some foods are really much easier to identify if it's has gluten or it's gluten-free. But there are some foods that require a little bit more investigation on whether it has gluten. Gluten that's been added to foods to help flavor or thicken the food is what we call hidden gluten, okay? And we really need to pay attention to hidden gluten. So with that said, I'm gonna highlight a few examples here. So meat substitutes, an example here would be meatless burger patties that could have wheat flour. Ice cream could be made with malt, or it could have cookie bits that are made from gluten-based flour. Oat milk can be made from pure oats, or it can be from oats along with other grains. And then certainly with buckwheat and oats, these foods can be eaten on the gluten-free diet, but it's super important that They're made from any products that we choose from that are come from gluten-free companies, because there's such a high risk of contamination of gluten into these grains. Dried fruit, it could be possibly dusted with flour, or it can, there could be a glaze on the dried fruit, and that could also be made from flour. Flavored tofu, tofu is made from soy, which is gluten-free. Flavored tofu can have soy sauce, which is not gluten-free, it's made from wheat. Broth can have hydrolyzed wheat protein. Marinades could be made with soy sauce. And any type of sauces like gravy, sometimes flour can be used to thicken that sauce. And we already touched base on soy sauce. And then soups can also be thickened with flour. So these foods still can be eaten. We just have to make sure they're gluten-free. And then last, I can add is modified food starch. If the starch is not specified, then it may be with gluten or it may not be gluten. So it's important to ask questions. So with that said, what can you eat on the gluten-free diet? Surely enough, there are many, many foods that are naturally gluten-free across all food groups. And once the foods are determined not to have any hidden gluten, these foods can be eaten too. To highlight a few, plain dairy, plain milk, plain cheese, certainly are gluten-free. If any of the dairy is flavored, then we just need to check if it has hidden gluten. There are a wide variety of grains that are gluten-free. So quinoa and brown rice, rice in general, are gluten-free, are considered to be whole grains. And then whole grain flours, bean flour, chickpea flour, nut flour, pea flour, brown rice flour, a wide variety of flours are used to make gluten-free breads and pastas and cereals. Any fruit, any veggie, or fresh fruit, fresh vegetables, certainly along with frozen or canned. If it's plain, it is gluten-free. If it comes with a sauce or any type of flavoring packets, we just need to check for hidden gluten. Dry beans and dry lentils, even canned beans and canned lentils that are plain are gluten-free. But again, if it comes with the sauce or part of a soup, just check. And certainly plain spices are gluten-free, but if the spices are part of a seasoning spice mix, then there is, again, we just need to check if it has hidden gluten or not. And then certainly vinegars, most vinegars are gluten-free, malt vinegar is not. And then certainly any type of starch made from corn or rice are certainly gluten-free. So we already talked a little bit about foods that are gluten-free and not gluten-free. I'm going to highlight some beverages that may have gluten, with gluten or gluten-free. So with that said, some products of Ovaltine are made with malt, so it's not gluten-free. Ale and beer and lager are made from barley, so not gluten-free. For hidden gluten, malt can be added as a flavoring agent, so flavored coffee and tea, herbal teas, wine cooler are some examples there. And then certainly plain coffee and tea are gluten-free. Fresh smoothies with whole ingredients are gluten-free. Of course, water is gluten-free. So certainly there's plenty of options here. So with that said, moving into gluten-free grocery shopping. With the grocery shopping, the hardest thing is to make sure that you or someone that does the grocery shopping in the household knows how to read the food labels correctly. Looking for the term gluten-free on the label helps you identify the gluten-free food. However, as we discussed earlier, the term gluten-free is not always written on the package, so it's important to read. And certainly it is important to continue to read the ingredients to help you spot the terms used to describe gluten. Open bins involve foods loosely placed in there without any packaging, and then scoops are used to place the foods into individual bags. There is a high risk of accidental mixing of foods that are gluten-free with foods that have gluten. So buying from open bins is not recommended because we're not clear how everyone is practicing placing foods from open bins. And certainly the perimeter of the grocery store will have a lot of typically naturally gluten-free foods. And certainly what I also want to highlight that nowadays grocery shopping, if done online, it's really important to click on the product's ingredient list before you add that product to your cart. And certainly with online grocery shopping, if certain products are out of stock, it would be helpful to indicate your replacements so the shopper doesn't just guess. We're not clear of the knowledge level of the shopper, and it may possibly vary when it relates to gluten. The skill of reading food labels will become easier and easier with ongoing practice. So I'm going to take a small break right now, and I want to do a small exercise. And I want to invite all of you to look at this food label and just to see if you can spot the possible gluten here. I'm going to give all of you 10 seconds to take a look at the label, and then we're going to go over it together. Okay, so I'm going to go ahead and get started. So I'm going to highlight the first, natural flavor. What does that mean? Natural flavors, as it's defined, it's an ingredient that's made from a plant or an animal-based ingredient. Plant-based, wheat is plant-based, so is barley, and so is rye. So I don't know whether it's a gluten-free natural flavor or, or is it with gluten? As I mentioned earlier, wheat is required to be on the label if there's wheat. So if this natural flavor is related to wheat, it will say so. The second one I can highlight, again, this label mentions natural flavors, but now they actually put including malt extract in parentheses. And we know that malt is not gluten-free, and it's important to question natural flavors. Certainly the manufacturer can be contacted to learn a little bit more, but this item is not appropriate on the gluten-free diet. Okay, so moving into supplements and medications, certainly supplements such as fiber or vitamins, herbal supplements will include an ingredient list on the bottle. However, the ingredient list on the medication is often included in the package insert. The key here is that if the type of starch is not listed in the package insert or on the bottle, it may come from gluten or it may not come from gluten, and we need to learn a little bit more. However, the use of corn or potato or rice or tapioca starch is gluten-free. If you are ordering online, just certainly any of these supplements or medications and getting it shipped to you, just making sure you read the ingredient list first. And certainly, if unclear, you can always give the manufacturer a call or contact them through their website or enlist the pharmacist. So with that said, being gluten-free in a shared kitchen, we live with others. Others are not gluten-free around you. And although you may know your diet well, they may not know your diet well. So it's really important that we reduce any risk of cross-contamination where gluten can accidentally come into your foods. It would be helpful to set up a system in the household of how to identify gluten-free foods. Some people like to use colored round stickers. Some people like to use a separate cabinet to store gluten-free foods. Certainly preparing gluten-free foods away from gluten-containing foods would be helpful. So maybe a separate area of the kitchen counter is an example I can have, or using a separate toaster. And certainly not allowing anyone to double dip. So examples I can give is that double dipping in butter or any other condiments, it would be helpful. If squeezy bottles or separate containers can be used, that would be helpful as well. So with dining out, one of the life's simple pleasures is to dine out at restaurants to help explore different cuisines, especially if traveling abroad or celebrating a milestone of some sort, So with that said, dining out increases the risk of cross-contamination as others are preparing the foods, and we're not always clear of the knowledge level of those preparing the foods. The solution here is not to avoid dining out. It's just really learning how to ask the right questions and learning the menu prior to help you plan. And also asking questions to the restaurants to learn of their gluten-free practices. And certainly nowadays, there are home delivery services for meals. The same practices apply. So practicing some of these strategies can help you plan and make well-informed decisions in the restaurant so you can still enjoy the foods you want to enjoy. So with that said, to go over menu terms, to highlight a few that could be on the menu. Again, decoding the language. Encrusted means that this food may have flour or breadcrumbs. Dust meaning that this food has been dusted with flour, like chicken could be dusted with flour before it's cooked. Marinades may have soy sauce, as we discussed before, and teriyaki sauce also may have soy sauce. And certainly asking the right questions, you know, this is just a partial list, but again, knowing how to ask the right questions can help you learn more. So for example, if there's an entree that you're interested in and there's a sauce with it, is it made with flour, or what type of flour? You may look at the French fries, and potatoes are gluten-free, but is it fried in the same oil used to fry other foods? They may not make it gluten-free. You may enjoy that gluten-free pizza, but is it cut with the same cutter as other pizzas? So overall, asking the right questions can certainly help you learn more. So we're going to do another exercise of finding the gluten. I want you to study the salad bar and tell me where the gluten is. And I will give all of you 10 seconds to find it, and then we're going to go over it. Okay, so right in the middle, the croutons are placed with, you know, the gluten-free foods around the croutons, and this increases the high risk of contamination, and it really shouldn't be placed there. If any of these croutons come into the foods, those foods are not gluten-free. It really should be in a pourable container, so that way the croutons can be used by those who are allowed to use croutons and leave the gluten-frees alone. Another quick exercise is that here is an entree with a description of the ingredients. I'll give you also another 10 seconds to take a look at it, and then we'll go over it. Okay, so with that said, chili spices, what spices are used? Is it fresh spices, or is it a seasoning spice mix? The mango glaze, is it, what ingredients are used there? Is it made with flour? Is it made with soy sauce? And certainly last, the rice. Is the rice cooked in broth? If so, is the broth gluten-free? So those are some examples of questions you can ask about this particular entree. And then certainly if the food is not gluten-free, it would not be appropriate to eat. Okay, so with that said, building a gluten-free diet plate. Certainly a healthy gluten-free meal has multiple food groups at that meal. We want to see the fruits and vegetables there. We want to see some aspects of a dairy there that you can tolerate. If you're lactose intolerant, then certainly choose lactose-free dairy. Gluten-free grains, your protein in as well. An example of a meal I can give is, say you do scrambled eggs in the morning with some spinach, and you do some plain yogurt topped with frozen blueberries and almonds and a little bit of honey. And that's an example of a well-balanced gluten-free diet. And I highly encourage you to treat your diet like a worksheet and see how you can plug in the different food groups to help make your meals helpful. Okay, to wrap it up, with that said, staying on top of the gluten-free diet, as I mentioned earlier, it's really meant to build healthy habits over time. You really need to ask yourself, what do you need to make this easier for yourself? Certainly inspecting the environment around you will be helpful, and continuing to read the food labels so you stay well informed. And then, you know, a key aspect is working with a registered dietitian who knows the ins and outs of the gluten-free diet well, to help you master all areas, or maybe one area for your culture and lifestyle. Again, ask yourself, where do you need help in? And the last I can mention is to continue your follow-ups with your doctor to help you assess the health of your small intestine. Okay, in summary, the gluten-free diet is a lifetime therapy for celiac disease and can be helpful for wheat allergy and non-celiac gluten sensitivity to help find food options. And overall, to follow the gluten-free diet effectively, all three phases needs to be done. Certainly learning what foods are gluten-free and not, practicing the different skills to help you implement this diet, and certainly maintaining the gluten-free diet to help you build habits over time. And certainly, again, I can't stress enough, work with a registered dietitian to help you integrate this diet in a way that you can enjoy and it accommodates all your other lifestyle needs. And here are some resources that I can highlight. And then last is that we have upcoming webinars from our fantastic physicians and dietitians, and we encourage you to come back and learn more. Thank you.
Hi, my name is Nina. I'm the nurse working with Dr. Fernandez-Becker. Thank you everyone for contributing such great questions to this webinar. So I'll go ahead and start. We do have a few more minutes here. So one of the questions that I see here for you, Dr. Fernandez-Becker, is do you recommend biopsies after a certain interval of years on a gluten-free diet, or only if a patient or someone is experiencing ongoing symptoms?
So if I heard you right, is whether we need to, when do you repeat an endoscopy?
Yeah, when you recommend, yes, exactly.
Great. So like I said before, it takes a long time for the lining to heal, and there aren't any strict guidelines about this. So it's easy if there's symptoms because that makes the decision a little easier. However, most experts would recommend repeating an endoscopy after 2 to 3 years to document that the lining is healing.
Great. What about going on a gluten-free diet without diagnostic testing? How do you feel about that?
That is difficult because once we take gluten out of the diet, then the antibodies that we use as diagnostic tests and also the mucosal changes or the injury that we see actually get better. So it makes it very difficult to make the diagnosis of celiac disease. And in those instances, sometimes we have to do what's called a gluten challenge, which means that we have to have you eat gluten again for a certain certain amount of time, usually 4 to 6 weeks. And obviously, as you know, that's very difficult. So I recommend that getting an evaluation before starting a gluten-free diet.
Great. Another interesting one here. Does the number of antibodies in a blood test for celiac disease indicate the degree of the disease?
Well, the antibody tests that we use for diagnostic tests are great screening tools. So they're really great to tell us whether you have the disease or not, or as indicators of somebody who needs to be evaluated further. And in general, the higher the antibodies, the more active the inflammation. However, once you're on a gluten-free diet, they're not very helpful at telling us the health of the intestine. And it takes 6 months to a year for these go away. They go away at different intervals in different people. But they don't tell us really whether you're healing or not. They tell us more of what your gluten-free diet is like.
Great. Neha, we'll switch some for you here. Patient asked, because they are following a gluten-free diet, do they need to be concerned of anything lacking in the diet that might be needed?
No, that's a great question. So for one, the gluten-free diet includes foods from all across all food groups. So as long as one is including all the food groups in the diet, certainly you will get all the nutrients that you need. In the process of healing for those with celiac disease, certainly gluten has impacted the gut and we need it to heal. So at that time, certainly absorption of some nutrients like fat-soluble vitamins, vitamin A or D, or certainly thiamine may not be absorbed as well. Another aspect I can highlight is that again, with celiac disease, gluten can be, certainly impact the gut, and dairy at times by others may not be tolerated as well. So some of my patients that I've worked with in the past, they have reduced their dairy intake. So there's less calcium and less vitamin D coming in. So we also look for ways that we can add back lactose-free dairy to help them tolerate dairy better, or maybe we need to look at supplementation for that. But again, as your gut heals and you're able to include all the food groups in the diet across the board, then you can certainly meet all your nutritional needs.
Great, thank you. There's been a few questions concerning weight around the gluten-free diet. There's been some, is there weight gain due to the gluten-free diet? Can I lose weight doing the gluten-free diet? Is there evidence of this?
That's a really great question. I get that question often. So to lose weight on the gluten-free diet, we haven't found any significant associations between that. It can be actually, weight gain can happen with the gluten-free diet, especially if the small bowel, the small intestine has been impacted by gluten. It affects our absorption of nutrients. So as we take out the gluten and allow our gut to heal, our small intestine to heal, then that's when I've seen weight gain to happen because you're absorbing so much better. So to help avoid unwanted excess weight gain, you may need to certainly look at a balance of all the food groups, making sure you include all your fruits and vegetables and legumes in the diet as an example. Eat enough portions that satisfy your hunger, but not to overeat so you don't get those extra calories, and look at ways that we can also make sure you're consistent with physical activity and exercise to help you reduce that unwanted excess weight gain.
Great, thank you so much. Dr. Fernandez-Becker, a few more for you. Let's see, very interesting. Someone is wondering, can gluten be absorbed through the skin?
In general, from our understanding of celiac disease, you have to metabolize it, ingest it and metabolize it, and for it to cause what we call the celiac lesion. That said, there are reports of some individuals who have a sensitivity to skin, and these people are people who have a disease called dermatitis repetiformis, which is basically the same reaction that's occurring in the gut, but it occurs in the skin. And there, the treatment is also lifelong gluten-free diet. And the interesting thing is that most of the people who have dermatitis repetiformis don't have symptoms of gastrointestinal disease, but when you look, the vast majority of them have some small intestinal involvement. Now, all of this is, there's a lot of research going on in understanding why in certain people, gluten causes one set of symptoms and in other people others. So stay tuned.
Great, thank you. Another patient asked in, I hope I'm summarizing this correctly, basically wondering, is the amount of years you have celiac a predictor of health? If I can elaborate if you need. Do the number of years one has been diagnosed influence comorbidities?
Well, you know, the good news with celiac disease is, for the most part, in most patients, once you remove gluten, things get better. However, get better in terms of the gut healing. That said, some people do have symptoms that are related to conditions that seem to be more common in patients with celiac disease. For instance, something called microscopic colitis or small intestinal bacterial overgrowth. There is a very rare complication of celiac disease, which is something that we call refractory celiac, in which the injury to the lining is no longer responsive to gluten. So gluten is no longer driving it. And this is something that we need to recognize, because although it's incredibly rare, and in the 10 years that I've been here, I've seen one case.
Wow.
It can predispose to lymphoma. So it's something that we don't want to miss. So if somebody's not getting better, obviously we're going to look for all these things. But we really don't understand what are the predictors of that complication. And again, this is an area that's been fairly heavily researched. So hopefully we'll have better answers.
Great. And I just wanted to leave this open to you, Dr. Fernandez-Becker and Neha, if you guys have any closing remarks or anything else you guys would like to add in.
Well, one thing that I wanted to add, and I saw one question that was trending often, is whether first-degree relatives of patients with celiac disease should be tested. And the answer to that question in general is yes, because given the genetic component, the likelihood of a first-degree relative, either a child or a sibling, to develop celiac disease is about 1 in 22. So it's high. But for the parents that are asking about whether their children should be tested, they should understand that the antibodies that we use as screening tests do not perform very well in children under 2. So it's important to work with your pediatrician, make sure that an at-risk child is meeting all their milestones. And if there is concern, then see someone who has expertise in celiac disease, a gastroenterologist.
Thank you. Anything else?
Dr. Fernandez-Becker, we have over 54 questions and there's no time to answer them. So
Okay.
I'd like to suggest that if people would like to receive an email with the answers to the questions, you can send an email to digestivehealth@stanford.edu. I've also put this in the chat, but if you send your email address to digestivehealth@stanford.edu, we will answer the questions as best that we can and send them back to everybody that asked for it.
Absolutely.
The video will also be live, be available on YouTube soon to be able to watch, and the slides will be part of that video presentation.
Great. Yep. I'd be happy to respond to any of your questions. Thank you so much.
Absolutely. Thank you for having us here today.